Gives preliminary approval to overdose prevention sites, sometimes called safe injection sites.
Lawmakers voted 96-35 to allow for places where people can consume illicit drugs under medical supervision. Channel 3 political reporter Calvin Cutler is live at the State House. Calvin, break down this debate for us.
Yeah, good evening, Kat and Darren. It is a passionate issue on all sides, with House members tonight sharing personal stories of friends and family who have been impacted by addiction and opioids and mental health. Now, at issue here is how best to get at some of the challenges facing the state of Vermont from opioids and from fatal overdoses. Continuing to set new records, some state lawmakers say that the state needs to take a new approach.
For all opiates.
10 years ago,
what started as an Oxycontin and prescription drug addiction problem in Vermont has now grown into a full-blown heroin crisis.
Democratic Governor Peter Shumlin raised alarm bells about opioid addiction, promising an all-out effort to stem the tide. A decade later, overdose deaths are skyrocketing, driven by the deadly opioid fentanyl, and now xylazine, resistant to overdose-reversing medications. So Wednesday, in an emotional debate, lawmakers turned to what they call a new way to combat overdose deaths.
I want my community to stay alive. And I want us in this body to do everything we can to make that happen.
State lawmakers working on a pilot program for communities to set up safe injection sites where people can consume drugs under medical supervision without legal consequences, and funded by a fee on pharmaceutical manufacturers and opioid settlement funds. Supporters say it will help clean up needles on the street and connect people with treatment resources.
In a year where public safety seems to be at the forefront of our priorities, it is clear that we need to expand our approach to address this crisis.
While others question whether they would work in a rural state and say Vermont shouldn't gamble with addiction and treatment.
Recovery, prevention, education, and treatment. Those are known, proven, evidence-based, best practice, trauma-informed practices.
While others have philosophical differences. Governor Phil Scott calls the bill a bridge too far.
I just don't think a government entity should be in the business of enabling those who are addicted to these drugs that are illegal.
The debate over safe injection sites comes in a bigger conversation about public safety, drugs, and housing. Top brass in the state police say harm reduction is only part of the public safety puzzle. Public Safety Commissioner Jennifer Morrison says Vermont's criminal justice system also needs enforcement and consequences.
We do not put people in jail. We don't have mandatory treatment. And we are literally giving people citation after citation.
But back at the State House, there are still questions about who would run the safe injection sites, where they would be placed, and how to staff them. Now, the Department of Justice under President Biden has essentially turned a blind eye towards similar sites in New York City. However, there's still questions about how a DOJ under a Republican administration would approach harm reduction and safe injection sites. Now, the House will vote on this measure one more time before sending it to the Senate, where the Health and Welfare Committee will take it up in the coming days. Reporting live at the State House, Calvin Cutler, Channel 3 News.
Calvin.